All right, good afternoon, everyone, and welcome to today's webinar. My name is Jorge Acosta Palmer, and I'm the director of the Statewide Training Initiative with Florida Legal Services. We're excited to have you join us here today for Harnessing the Power of Medicaid for Children and Adolescents. Before I introduce our speakers, I do want to go through some quick housekeeping announcements. The training is being recorded. You're going to receive a copy of the recording via email. I'll also be posting it on YouTube like within 24 hours, so be on the lookout for that one. The training was approved for the Florida bar for like all sorts of CLEs, so I'm just going to read them out loud. It's 2.0 general CLEs, health law certification credits, juvenile law certification credits, and elder law certification credits. So that's two CLEs for all of those. And the cherry on top, we also have a zero point 0.5 technology credit approved for this CLE. So I'm going to announce the CLE code towards the end. I'm going to drop that CLE code into the chat. It's also going to go out in that email that I send out automatically from Zoom. And I will also include it in the YouTube description for you to find. So no worries, it's going to go out. So if you do need a certificate of attendance, I'm going to ask for you to email me after the webinar. Do not put it in the chat or the Q&A because I may accidentally miss out on it. So if you email me after the webinar, I'll make sure to get those ready and send them out all in a row. Closed captions are enabled for anybody who needs them. So if you're having any issues with accessibility, please let me know and I'll reach out to you directly. So the training is being co-hosted by the Public Interest Law section of the Florida Bar, or PILS. So if you're not familiar with PILS, I'm going to drop the link to their website into the chat. So please check it out. This webinar is also being co-hosted with Florida Children's First. So I'll also be dropping some information about their organization into the chat as well. And final piece of housekeeping announcements, you probably will have a lot of questions. So we're going to ask, we have an hour and a half of content today. So I'm going to ask you to hold your questions towards the end and please use the Q&A feature so we can address those questions towards the end if time permits. So since we have three speakers today, I'm not going to go with the full bio. So I'm going to ask that if anybody has sorry, if anybody wants to read the full bios, they can find those in the materials that I'll be sharing towards the end. So with that said, I'm going to pass it over to Robin as our first speaker. Robin, the floor is yours.
Hi, everyone. I am very excited to be with you for this really important webinar on Medicaid for kids, children and adolescents. Many of you have been on Florida's Children First webinars in the past where we focus on issues relating to kids in the child welfare system. One of the most important things that you can do if you're working with kids in the child welfare system is to make sure that they can access what they are entitled to via Medicaid. And so I have always relied on my colleagues at Florida Legal Services and their expertise with Medicaid when issues come up for the kids that we're working with. So I'm so pleased that they agreed to do this webinar today. Don't let your head explode. There's a lot of information in here and you might not get to ask your questions. You might not have your questions answered online. There's just that much that we're going to be tackling today, but we're all here to help afterwards if we can't get to it today. So make notes about what you want to ask questions about. All of the slides and a ton of other material will be made available to you. So you can actually just listen and mark down things that you want to follow up on. If you'll go to the next slide, please. Actually, two more slides. That's us. Hi. And so this is the topics. You can go to the next slide. These are the topics that we're going to cover today. It is a ton of information and it's small print on these screens, but you'll have access to it. So don't freak out about it. Before we kick this off, I just want to back up one more second. Jorge is sending you materials about Florida's Children First. If you're not already a registered user of the Florida Dependency Law Center, I encourage you to do that. It's free. It's for attorneys and judges only. I'll drop in that link in a little bit. And Jorge will also be sending you materials on the FCF training series that's going to start in September on the third Wednesday of every month on topics of interest in the child welfare system. So next slide, please. Why are we talking about Medicaid for kids? There are so many urgent things that children, especially those who have suffered trauma or involved in the child welfare system, and frankly, their parents, and as they become parents, health and mental health issues are critical. And this slide just talks to you about the number of issues that come up and the ways in which Medicaid can improve the lives of the children and their parents. So hopefully I don't have to convince you how important it is. Next slide, please. The next thing I want to take just really a brief look at is that Florida has really been, in addition to providing the direct Medicaid services for children and parents, Medicaid is a part of the child welfare funding system. We're kind of on the low end of usage compared to other states. Child Trends, who examines child welfare financing, just put out the current report, which is a look back to 2022 data. In 2022, Florida was using, of the overall funding for child welfare, Medicaid comprised 1%. In other states or nationwide, that number is about 3%. But you can see from this chart that the amount of funding in Medicaid that the system is using is increasing substantially, increased 31% in the 2-year time period between 2020 and 2022. This is for things like targeted case management, services that are provided in therapeutic group homes, and other child welfare programs that have a therapeutic component. So if you are working in the system, not just with individual kids, but thinking about how we can make the child welfare system better, be thinking about how Medicaid can be tapped to improve the overall child welfare system. So that's my cheerleading to hopefully get your brain started and excited about what you're going to hear. And now I'm going to turn it over to my colleague, Amy Liem, to jump into the details. Thanks, Amy.
Thank you so much, Robin, and thank you all for joining us. Robin, I was just calculating real quick how long I think we've been working together on Medicaid issues, and I think we're closing in on 20 years. And so Florida Children's First, along with YouShine, has just been such a great community partner on these issues, and advocacy. The work that we've done together has been so important. And I think that all of you who are joining here today as well kind of understand that Medicaid is about partnerships. And we're going to talk a lot about that, but it's not just the partnership at the federal level and the state level that's so important, but it's the partnerships among the communities and the advocates and working together to make sure children are accessing these services are so important. So even though we are focusing on Medicaid benefits for children, I wanted to start with an overview of the Medicaid program. And if we could go to the next slide, because it's important to kind of understand the history and basic principles of design, because they have such an significant impact, not just on how children's access services, but how the entire Medicaid program is implemented in Florida. You may have heard Medicaid just celebrated its 60th birthday in July. It was back in 1965 that Medicaid was established to provide medical insurance coverage to low-income Americans. And it was authorized under Title 19 of the Social Security Act. So it was signed into law alongside Medicare. And unfortunately, the two programs have been confused ever since and often referred to as the same program. But Medicaid is very much a separate program from Medicare program, which covers adults over 65 as well as adults with disabilities. Another important thing that is crucial to keep remembering is that it's a voluntary federal-state partnership, which basically means that it's created at the federal level, and states had the option to participate in the program. And even though it took several years for some of the states to decide they wanted to take that option, ultimately they all decided they wanted to create these programs. And now every state and DC and the US territories have Medicaid programs. But initially, the eligibility requirements were very strict. Medicaid only served a limited population of individuals, specifically families receiving cash assistance, and it covered fairly basic services. But it changed significantly over the last 60 years, and over time, eligibility has been expanded to cover more populations, including people with disabilities, people with long-term care, young adults formerly in foster care, and services have been so much more expanded. But all along, the general purpose has remained the same, and that's to provide health insurance coverage to those in need, particularly low-income individuals and families. And so with all that growth, it's come from a very strict, limited service that was provided to now the largest health insurance plan in the US. And you can see in the data chart that over 71 million Americans receive Medicaid. And in Florida, it's 3.5, with approximately 2.2 million of Florida's recipients being children. So children in Florida make up over half of the Medicaid recipient coverage category. Glorian, can we go to the next slide? So not surprisingly, as the largest plan in the country, and for those of you who've worked with on Medicaid issues a lot, you know that it has a reputation for being a very complex program that changes a lot. And one of the biggest contributors to its complexity is this federal-state partnership aspect that I've touched on. It's also referred to sometimes as cooperative federalism, which essentially means that both the states and the federal government each play a role in the operation of the program. And while states do have a lot of flexibility with the Medicaid program, they must follow parameters set by the federal government, and they have to get approval for how they decide to implement the programs at the state level. And obviously that, just like with all relationships and partnerships, that can often work very smoothly, but sometimes there can be tensions in that partnership. Administrations at the state and federal government may not always share the same views on how aspects of the program should be implemented. And as a result, Medicaid laws and policies can be subject to frequent change based on priorities of different administrations. So if we could go to the next slide. And kind of an example of how Medicaid has continued to change throughout its history, and how it's influenced by the kind of greater political landscape and attitudes towards public benefits. I wanted to include these significant Medicaid dates. And by no means are they all inclusive, and they don't cover everything that's been significant about Medicaid. But I think I've included them because the timeline kind of shows a lot of the significant events relating to children, as well as just how quickly the changes can be made. However, at the same time, while laws and policies can change, the timelines also illustrates that some of the changes are not actually implemented immediately. There's usually a lot that happens at both the state and federal level before the changes can fully go into effect. And there's opportunities at state level to impact how those laws are implemented. And I won't spend too much time on it, but I just kind of wanted to point out the timeline. For instance, as we talked about, the Medicaid program was created in 1965, but within 2 short years, they already realized that they needed some more detail relating to children coverage, and so they passed the EPSDT requirement, which we're going to talk about. But what's interesting is if you see within two years that had been changed at the federal level, but yet the states overall all around the country hadn't even fully decided that they wanted to implement Medicaid. Florida was actually one of the last states to decide that they wanted to implement Medicaid. Didn't do that until 1970 after the EPSDT coverage had been added. And so other things like, I'm sure we're going to talk about it more, and many of you are already familiar with the Children's Health Insurance Program that's gone through Florida Kid Care in Florida. That was established in 1997, but it's still constantly changing. And there's actually was legislation to further expand that a couple of years ago. We're working on getting that in effect. And just finally, one thing I wanted to point out too, because I know it was a very important part of the Affordable Care Act, and it was the Medicaid for former foster youth coverage until age 26. And that was actually passed as part of the Affordable Care Act, but which was done in 2010. But as you can see, it didn't actually go into effect until 2014. And even after that, it still took a couple of years to kind of work through the glitches and make sure that the application system was flagging those recipients to ensure that they were covered. So again, as we're kind of working with Medicaid and things are coming up and we'll be seeing changes in the future, it's important to, I think, to keep remembering that while things can change quickly, or there's also lots of room for advocacy and kind of working together to make sure that those changes are implemented so that they help the recipients, particularly children that we work with, access the benefits. If we could go to the next slide. Let's see. So I want to get into the EPSDT and the children-specific stuff, but I just want to emphasize again, one more time, how important the state-federal partnership is, and just really what it means for Florida when we're working and for recipients when we're working on Medicaid issues, what Florida's unique Medicaid program is. And so, yes, keep in mind it is a federal program, but each state designs its own unique Medicaid program through a state plan. We have our state plan specific to Florida with what they wanted to cover. We've also, through federal guidance and approval, must designate a single state agency. And in Florida, we've designated that single state agency to handle Medicaid issues as the Agency for Healthcare Administration. And Glorian's gonna discuss this a little bit more when she talks about accessing those services. But many of you may probably already know that even though ACA is our single state agency for Medicaid, there's a lot of other agencies in our state that actually work on Medicaid issues. So again, there's this constant partnership going on. And while it can be, it is designed to help and make sure that services are accessed efficiently. A lot of times with all of the partnerships and all the different, with all the different involvement, it can be a little difficult for recipients to determine which agency that they need to be working with. And so finally, one last thing that's so important about the state-federal partnership and just kind of understanding how each program is different is that states who participate, or states that participate in Medicaid, have to cover what's are designated mandatory services under the Medicaid law at federal level. And EPSDT, which we're going to talk about, is actually one of those mandatory services. So to participate in Medicaid, we've got to make sure we cover that. However, there also is a long list of optional services that states can choose to cover. And that's where we really can get a lot of confusion, and really makes each state different because of how they decided that whether or not they want to offer those services. And just, I think Jorge or Robin mentioned that there's lots of materials. So throughout this as we're referring to some of these requirements and laws and requirements and policies at the federal level and state level, just wanted to let you know that they are going to be in the materials, and we've also kind of linked within the PowerPoint to some of them as well. And finally, one last thing to remember with the state-federal partnership is that, of course, Medicaid costs money. It's a significant part of both the federal and state budgets. And as kind of continuing with the state-federal partnership theme, both the state and the federal government share the costs. There is a percentage that's required that the federal government has to cover, and it's always over 50%. And the state's required to pay the rest of that portion. So we're going to skip the next slide. That goes into detail if you're really interested, because it is fascinating, but we've got lots of that if you want to dig into just the payment process and how the federal government pays for Medicaid. But just to keep in mind, federal government for Florida covers about 57.22% of the coverage or of the costs of Medicaid, and then the state pays the rest. All right, so I think we are going to go to the next slide. Okay, so now we're getting into the main children's comprehensive Medicaid benefits package for children, which is called the EPSDT benefit. And we can go to the next slide. And that stands for Early and Periodic Screening Diagnostic Treatment Program, EPSDT. Grab some water. And it's quite a name. It can cause a lot of confusion, and we're going to break it all down. But first, I did just want to touch again on the history, because it is so important, and I think a lot of the reasons why it was enacted in the first place still ring true today. It was enacted, as I mentioned before, it was enacted in 1967, shortly after the Medicaid was passed, and it was a lot in response to the lack of specific standards relating to child health coverage in the original Medicaid Act. It was also prompted by a study published by a task force that President Kennedy established to study youth health. And the task force found that 1/3 of males could not enroll in armed services due to physical or mental health conditions. So obviously at the time that was a really alarming statistic, and it sort of directed the attention of the public as well as policymakers to children's health issues in the US and the need to really provide prevention and make sure that children were getting the services they need. So soon after that study, in a 1967 letter to Congress, President Johnson vigorously advocated for comprehensive health benefits for children. And he really referenced the prevalence of untreated physical and mental health conditions among young people and the potential to impact individuals in adulthood if those conditions weren't treated. So he presented that to Congress, and shortly after, they passed this EPSDT benefits, and it continues to be a critical component of Medicaid program, an essential benefit for children today. And they're in many ways, the language is outdated, and there's a lot there, but just for fun, I did link, if you're interested, both that study and that letter back from the 60s, because in so many ways, we're continuing to see the same issues today. And really, there was a couple parts of the quotes that I just kind of wanted to hint at, or because I think they hint at some of the themes that we're saying, and for the themes that we're still saying with access to care for children. And President Johnson, he really emphasized that the goal must be clear, that the early years are critical and that every child needs to be given the chance to fulfill his promise. But also buried in the letter, I thought was some really interesting words that kind of go along with the partnership theme, the working together theme. And he pointed out that the future of many children depends on the work of the local public health services, the school boards, the local child welfare agencies, and the local community action agencies. And so I think 60 years later, or almost 60 years later, that's still so important, and it's only grown more. It's those agencies, it's those, continues to be children's advocates, legal aid attorneys, just child welfare staff, and as well as the agencies, the different agencies that are providing these services. And it really, again, reiterates that theme that Medicaid, it's about partnerships, the relationships, and the working of community partners together in order to make these benefits a success and the children able to access them. So let's go to the next one. So that's the history. So let's talk about what it is. So EPSDT, again, the name turns a lot of people off, but it's early periodic screening diagnostic treatment program. And what it is it's the children's benefit package. And it is much more robust than Medicaid benefits for adults because it does exactly what is intended to do 60 years ago. It's designed to make sure children are receiving early detection and care so that health problems are averted and they're diagnosed and treated as early as possible. And I mentioned before, this is one of those mandatory services that states have to cover if they're going to participate in the Medicaid program. And one of the issues with it, though, is that sometimes we name things, I think probably to get away from the EPSDT complicated name. It's been nicknamed different things, well child checkup. For quite a while, Florida was calling it the Child Health Checkup Program. So it kind of gave the impression that it's more just about the routine checkups that children have to have. But in actuality, it's so much more than a child checkup program. We could go to the next slide. So kind of want to break down what the EPSDT stands for. The name spells out and summarizes the purpose of its goals. The problems should be identified early, the E. Children should be evaluated at periodic intervals, the P. Children should receive physical, mental, developmental, dental, hearing, and vision screenings to identify prospective health issues. And then the diagnosis should be made. And the periodic screening requirement involves having providers conduct screenings at age-appropriate intervals based on standards set by the pediatric, medical, and dental communities. And by evaluating children regularly with age-appropriate screenings, the EPSDT benefit strives to prevent medical conditions from occurring or reoccurring. States must also cover visits that are interperiodic. So in other words, if a child has symptoms outside of the regularly scheduled checkup period, the EPSDT benefit should cover that visit with the provider who can examine and diagnose even if that visit's not under the routine care. We could go. So the screening and diagnosis part of the EPSDT benefit is obviously very important. And I think, Glorian, the next few slides kind of reiterate the screening requirements. I think we can go to the next one too. That provides a little bit more about the screening and services required for these programs. But let's go to the main events. So while the screening and the diagnosis are so important, next slide. It's the T, the treatment, that is really crucial to the EPSDT process. Because if really what good is a checkup, screening, diagnosis if the child is not actually getting the treatment that he or she needs? And you can notice that we've definitely starred this, and I kind of have to chuckle because Robin was very right in pointing this out when we worked on the first versions of the slide. We hadn't emphasized this enough, and she pointed out, I think this needs a little bit more pizzazz. So this is my effort to pizzazz it up, to kind of star it, to highlight it, to remind everybody that the treatment is the important thing. While it's all important, the treatment is what really makes the EPSDT benefits stand out for children. It ensures children not only receive screening and diagnosis, but it also makes sure that they get those needed interventions and care to address any healthcare needs. And any illness or condition that's discovered during a screen must be treated and covered by EPSDT. And this language is really important. And it kind of pulls together what we were talking about with the Medicaid program and requirements about states being required to provide some services and allowed to choose other services that they want to require. Well, the EPSDT, under the EPSDT benefit, any Medicaid covered services that are necessary to correct or ameliorate a diagnosed physical or mental condition, whether or not the state covers that service for adults, must be provided to the child. So again, we have services that Florida has to require or is required to provide, mandatory services like EPSDT, but there are a list of other services they can choose. Well, regardless of whether or not Florida has decided to provide those optional services for adults, for children, if that service is necessary, they need to provide it to the child as well. And we can go to the next slide. So this is, again, we have in the materials the link to the site where you can see all the mandatory and optional services available for Medicaid. But an example of these are some of the services that are covered under the EPSD2 requirement, both optional and mandatory. But I also want to draw everyone's attention to the very last bullet, because it's almost a catch-all. It's a service that it's called the other diagnostic, screening, preventive, rehabilitative service, including medical remedial services, recommended for maximum reduction of physical or mental disability or restoration of an individual to the best possible functional level. And you can see that service is almost all encompassing nearly almost everything that a child would need in order to get the restoration of an individual to the best possible functional level could be covered under that, or kind of fall under to that catch-all. So again, you can see it's a very broad and comprehensive, and it's also very different in a lot of ways to private insurance. And it's part of the reason why sometimes Medicaid has been called Cadillac coverage, or pointed out that it is very, very comprehensive. However, at the same time, as we've talked about, it's complex and there's a lot of confusion about Medicaid. And so this is also an area where people don't always think that Medicaid may be providing everything, and with children, or be providing the services that are necessary. But with children, it's really important to question that when children aren't receiving services, when children are denied, because the way the EPSDT package has been set up, as we pointed out, nearly every benefit or every covered service that they would benefit from should be required. So it's important to, as we're working with families and hearing that their children are being denied, to kind of question that and figure out whether or not they've been correctly categorized under these covered services. So that's the first step, just to figure out the covered service the child needs and make sure they're able to access that. But the other very important part of that, if we could go to the next slide, Glorian, is the medically necessary standard. So, excuse me. So we talked about the requirement being that any medically necessary service to correct or ameliorate a condition needs to be provided under EPSDT. And for the EPSDT program, the medically necessary standard for children is unique and much broader in scope than the adult standard. We kind of have both of them here. You can see, as I mentioned, it's services to correct or ameliorate for the child standards, but over to the adults. For Medicaid services to be considered medically necessary, they have to be necessary to protect life, to prevent significant illness or significant disability, or to alleviate severe pain. We can go to the next one. So this is actually another area that has caused confusion and which limits children from actually getting the services that they can get because of this confusion about medically necessary. So it's really important, again, as I mentioned, as you're kind of questioning and hearing that children might not be getting the services they need under Medicaid. First question, what's the service? Because nearly anything to help correct or ameliorate a condition should almost be covered under Medicaid. The second thing is, what are we saying is medically necessary? And so it's definitely make sure that the right medically necessary standards being applied. And in Florida, as we've set the policies and created our unique Medicaid program, the way we've defined medically necessary, or the way the states define medically necessary under the federal program, as I said before, is to prevent significant illness, significant disability, to alleviate pain. And that's actually in Florida policy and under 59G 1.010, which we've linked to. And that's how, when you look for the definition, or when advocates or providers, people working in the system, look for what's medically necessary, that's what shows up. For a while, this last sentence, you can see after the definition, it says this requirement applies only to recipients aged 21 years or older. That's recently been added, because for a while they didn't even have that. And so people would be looking for medically necessary definition, and they'd see that, and it could often be used for children. So as a way to improve it, the sentence has been added at the end, but it still can be very unclear. And there really is still no reference to the correct or ameliorate standard for children. And so not necessarily having that definition of medically necessary that meets the EPSDT level can continue to cause confusion and increase risk that children are being denied medically necessary services. So if we could go to the next slide. So I've kind of mentioned, as we're working with children and they're denied services or having difficulty accessing these services, remembering the EPSDT package. Just important to make sure that we're looking at what the statement from the provider said, to make sure it uses language like correct or ameliorate. And just as we're working with families, remind them of how important the child's care it is, and applying that appropriate, correct, and ameliorate standard. And one of the things is, we've talked about Medicaid, its complexity and the partnerships, and it can be difficult to figure out the regulations and policies, and where, particularly with families who are dealing with so much, and this information is not available. So we kind of have to, as partners and community advocates and working with families, kind of have to figure out where we can spread the word, and how we can maybe break up the complexity of Medicaid and EPSDT to make it more easily or so the families can navigate it better and kind of understand that the language in these requirements. So as much as you can, as you're working with families, spread the word about EPSDT, but again, also take into account, it can very much be confusing. And when we're saying things like EPSDT and talking about all the different levels of government and agencies and implementation, it can be overwhelming. So just kind of break it up. Think of how you can just help families access the issues and understand it, and make it more palatable. So just that whole concept of children being able to access what they need to make their condition better is just simple message that we can make sure that families are questioning and connecting, and then connect those families with our fellow partners and other advocates that and resources when they're not accessing those services. All right, so I think that's, if we could go to the next slide, Glorian. Okay, so that's we're kind of at the end of the importance of it. These, like I said, are some of the resources and sites, and we've got them in the materials. But I'm now going to turn it over to Glorian, because we've kind of talked about Medicaid, the background, the big important EPSDT package, but now we're at the point of how can children access these, and how can we connect children to those services. So take it away, Glorian, for how children enroll and access in those services.
Thank you, Amy, and good afternoon to all of our viewers today. Thank you for attending this program. As we all have said, it's very important. So as they have mentioned before, my name is Glorian Maziarka. I'm an attorney with the Children's Health Access Project at Florida Legal Services. And I'm going to be discussing enrollment in Medicaid, accessing services, and managing the children's health care, and some barriers to health care. So enrolling in Medicaid and accessing services to children. So who's in charge? So there are several agencies that are involved in this whole enrolling and accessing services process. Before delving into the process, we're just going to talk about which agencies are in charge. So the federal law requires states to have a single state agency responsible for administering the Medicaid program in their states. In this administration includes services and healthcare coverage. In Florida, the single state agency is the Agency for Healthcare Administration. We'll call it AHCA for short. And any issues with services and coverage are addressed to AHCA. But now AHCA doesn't handle the application and the eligibility determination processes. This has been delegated to the Department of Children and Families, DCF for short, and which is the agency that processes the applications and determines eligibility for the applicants. Therefore, if there's an improper denial of the application for Medicaid, then this appeal is dealt with DCF, not ACA. Now, the third umbrella would be the Florida Kid Care Program, which is the umbrella program that includes all of these healthcare programs for low-income families. And we're going to discuss that in a little bit more length later on. All right, so we have the Children's Health Insurance Program, which we call CHIP for short. This is the subsidized program for families that earn too much to qualify for Medicaid, but they still do not make enough to afford private insurance. So all the states design their own CHIP program in different ways. They submit a plan to the federal government, especially to the Department of Health and Human Services. In this plan, the state designs how it will use these funds, and they have to fulfill other requirements. With the materials that will be provided to you, there's a document with important links that includes the Medicaid.gov page, and it discusses how the state designed their CHIP plans. And, it can be very complicated, so we're not going to go too much into it today. But with the CHIP programs and the different plans that are in the Florida Kid Care Program, the monthly premiums are affordable, and they usually range between $15 to $20 a month. And that is to cover all the eligible children in the household. The Florida Kid Care Program has 4 components. It has Medicaid for children, which is, Medicaid for children, Medikids, Florida Healthy Kids, and Children Medical Services. So let's go one by one. Medicaid is the no-cost health care. So you don't pay anything to be in Medicaid if you qualify. So the families pay no premiums if their income qualifies them for Medicaid. Now, there are different age groups, and the income limits vary depending on the age group. So on the children between the ages of 0 to 19, they're all covered, but there are different age groups that have different income limits. So it's important for you to check on the income guidelines. They also covers young adults, 19 to 20, and foster care children up to age 26, as Robin had covered earlier, and Amy as well. For the subsidized groups, we have Medikids, Healthy Kids, and the Children Medical Services, which we call CMS for short. There are 3 categories for children who do not qualify for Medicaid, and all of these, as you can see, and I've broken down, they all have $15 to $20 monthly premiums. So Medikids are for children ages until 4 years old. They do have a full pay option if you are above a certain income. They have a full pay option of $248.21 per month. Then you have Healthy Kids, which that is when the child turns 5, they get moved into Healthy Kids, and they do have the same monthly premium, but their full pay options a little bit higher, is $259.50. It's important to note that once a child ages out of a group, they get transitioned into another program. So for example, the child was on Medikids, he was 4. A lot of the times people get confused. What happened? They changed my plan. It's because they got moved to Healthy Kids because they are in a different age group. The Children Medical Services is reserved for children with special healthcare needs. With these specific medical conditions that require more extensive type of services. So they are put into the CMS program. There's the same $15 to $20 monthly premium, but there's no full pay option for this one. In your materials, you will also find the Florida Kid Care website that has information about all of these programs, so you can go more into depth about those. All right, so these are the general income guidelines for Florida Kid Care. These are including the materials as well. I've also included information about the income guidelines for Medicaid as well. As you can see in the chart, it depends on the family size and the federal poverty level based on the family's annual income. Here's a little bit more of a visual representation of all the programs, including the age groups and the percentage of poverty. Right. So there are many eligibility requirements for Medicaid. These include, you have to be a Florida resident. There are age requirements, of course, proof of identity, and income and asset requirements. You must also be a U.S. citizen or have a qualifying non-citizen status. Please note after the OBA, the One Big Beautiful Act, Bill Act, a lot of these requirements will change. The eligible immigration statuses are going to change after the law takes effect. So be in the lookout for those changes. And it is also important to note that the eligible immigration statuses are different for adults and children. This is because children are eligible for Medicaid in Florida if they're considered a lawfully residing child. So the lawfully residing child is a huge, a lot of information, and it gets broken down depending on the statuses, and there's other requirements to that. So there's a lot of information to be given to people, and it's important to collaborate with immigration attorneys to fully understand their immigration status. So a good example of how it differs between adults and children is an adult with a pending asylum case would not be eligible for Medicaid in Florida. They could be eligible if they have a work permit and they are applying for ACA Marketplace, but not for Medicaid. Now, for a child, if they have a pending application for at least 180 days, they are eligible for Medicaid. So it is important that people understand this, because a lot of the times um, people get given wrong information in different agencies and being told that, oh, you don't qualify for Medicaid because you are not a citizen. And that's not correct. It depends on whether they're talking about a child or an adult. There's also a technical requirement to of having a social security number or having applied for one. Now, this is a very interesting topic and one that I work with clients, because there's arguable exceptions on federal and state law with this requirement. So we see some denials based on the lack of social security number, but in a lot of circumstances, they are lawfully retiring children that are not able yet to get a social security number. And then there's other types of social security numbers, like a non-work social security number. But that just requires some attorney involvement sometimes to figure those out. All right, application process. To apply for Medicaid, you have to apply through the Department of Children and Families website. So this is called the Access website. I'm pretty sure most of you are familiar with the Access website, because you can apply for all benefits altogether, including food stamps as well. You can apply online through the Access website. This is usually the preferred method, but you can also apply by calling the phone number. I have provided it there, or in person at their local DCF office. Now it's important to check if someone wants to apply at a local DCF office, check if they need to make appointments. Sometimes people just walk in and they don't have availability, so you might have to make an appointment. So make sure that you check with the local DCF office to see if that's required. The applications for other kid care programs is done through the Florida Kid Care. You can do that online. I put that link in there. And there's also a phone number that they can call if they don't feel comfortable applying online. Now, there is a no wrong door policy. So if you apply to the Access portal and you put in your income information and you earn too much for Medicaid, you should be redirected to Kid Care, and vice versa. You apply through Kid Care, but your income is too low that you should qualify for Medicaid, you should be sent over to that in order to finish the application. It's important to know that applying online is usually the best method. You can, as an advocate, you can assist someone with an online application, but it is also very important to tell applicants to keep the login information. I see a lot of issues where applicants have online accounts, but they have delegated that to an advocate or someone in the community, and then they cannot access their information on their application because nobody gave them the login information, and you have to resolve that through that DCF, which might be a little complicated. A lot of people say, well, you can do the forgot password by email. I have encountered many issues where people don't even have access to the email that was used to the account. So it's very important that tell people, if someone's helping you, keep your login, just in case that advocate is no longer available and you want to switch advocates, then that you can have that login information for that person. Right, so next we're going to talk about managing children's health care and the Florida statewide managed care program. In Florida, most Medicaid recipients are enrolled in the statewide Medicaid managed care program. This program was first introduced in 2013, and in February of this year, we had a whole revamp of the statewide Medicaid managed care program, and which is called the SMMC 3.0. So this program has three parts. The new program has the Managed Medical Assistant, which we call MMA. This is where it provides Medicaid-covered medical services like doctor visits, hospital care, prescription drugs, mental health care, and transportation to these services. Then you have the long-term care, which they call LTC. It provides services like care in a nursing facility, assisted living facility, or at home using community-based services. The enrollee must be at least 18 and meet nursing home level of care or meet hospital level of care if you have cystic fibrosis. But we're not going to touch too much on LTC today. And then you have the dental portion, which provides all the Medicaid dental services for children and adults. And all people on Medicaid must enroll in a dental plan. With the new SMMC effective February of 2025, there were new regions created. Before there were numbers, now we are in letters, right? And some regions got merged. Now the regions are composed of different counties. So if you go to the website, if you want to know what your region is, you definitely can go check. But this map kind of tells you the regions. There was a lot of issues where people, I was in region 1 or 2, or, on the different numbers, but some of the numbered regions got merged into letter regions. So it's important to know which region they're at. All right. And it's also important to know which region they are in, because all different regions have different health plans available to them. So there are certain health plans that are not available in certain regions. So it's important to know which region and then know all the different health plans available. Right, so once you're approved for Medicaid, voluntary recipients are automatically assigned to a plan, and they're going to receive a letter, right, telling them this is your plan. If they would like to change plans, they have 120 days. After that 120-day period, they are locked in onto the next open enrollment, unless you have good cause, you move to a different region that doesn't have that health plan, or you have other circumstances. And I put the other circumstances, I put the code there on the Florida Administrative Code that outlines those circumstances. You can also find a lot of information about how to change for cause in the member handbook for the specific health plan that person is enrolled in. All right, so choosing the correct plan. So choosing the correct plan is extremely important. A lot of times people don't pay too much attention. They think a health plan is a health plan, but different health plans may provide different services, including expanded services. So it's important for the applicants to understand the benefits covered by their assigned plan. And the advocates could assist with this. You can help them understand their plan benefits and the benefits offered by other plans if you can just review their member handbook with them, or logging into the portal, into the plans portal, and see what is being offered. You can use the Florida Medicaid member portal to compare plans. I've also dropped the link to that in the materials, and they have a very cool feature where you can compare plans together. And I also provided in the materials all the member handbooks. That way you don't have to look them up online. and for the plans available in Florida, and they list all the benefits. If you go to the health plans website, they also have all these member handbooks available for download. All right, so the new statewide managed care 3.0, they changed the plans. So there are some plans that are not available anymore as of February 1st of this year. And now the main ones that are relevant to this training are the three types of plans that are, well, two mostly. The Comprehensive Plus and the Managed Medical Assistant Plus are like the most common that you will see. And I will talk a little bit about long-term care. So the Managed Medical Assistance is a network of providers. The recipients are assigned to a primary doctor who manages that person's healthcare, and they do referrals to other providers when it's needed. I'm pretty sure a lot of people have experienced this with their own health plans. And then you have the Comprehensive Plus plans that have all-encompassing services. They'll have the managed medical assistance, long-term care, and the specialty services, including child welfare and children's medical services. Now, long-term care, it refers to a program for older people and people with disabilities who need nursing home or home and community-based services to assist them with their daily living. That will be included in the Comprehensive Plus plans. The specialty services, they can include services for specific circumstances like HIV, complex medical needs for children. Before, all of those plans used to be like separate, but now they're kind of all encompassed into the Comprehensive Plus plans. Specialty services that involve children are child welfare and the children medical services. The child welfare services provides personalized care for children in Florida's child welfare system to care for their physical and behavioral health needs. And the children's medical services are for persons under 21 that require special healthcare needs that require extensive preventative and ongoing care. I have also included in your materials the member handbooks for those two specialty plans, which are very detailed in everything that they include. And I also included the links to the website that have all this information and all these services. So as I said it before, the Comprehensive Plus plans is just that, comprehensive, right? It includes all of these together. You're going to see them very commonly offered by almost all plans offered in Florida. And the Managed Medical Assistant Plus plan is not as commonly offered as the Comprehensive Plus plans, and they only include managed medical assistance and some specialty services. Oh, and a side note to that I included there, the child welfare specialty services are only going to be included in the Plus plans. There's other plans like the Select Comprehensive that doesn't include child welfare. All right, so there are many tools to help with this process. You can find a lot of information about the statewide managed care in ACA's website. I have provided also the link in the materials. And understanding the services offered by the plan is very critical, and it's very important for the recipients to also know about expanded benefits. These are benefits that are available in the plans, and a lot of people don't take advantage of them. Definitely look through those handbooks and check the expanded benefits offered. There's great benefits there. Some plans have free gym memberships. Sometimes they have food assistance, housing assistance, caregiver support. You'll find some that have swimming lessons, GED prep. Some even have literacy classes. There's a lot of options that are available. Have anyone that you come across with, check your plans, expanded benefits. They're great, and take advantage of them. And a lot of them can be used, of course, for children. So it's very important to check which ones are offered in their plan, and also what can the children benefit from those expanded benefits. I also included in the materials the expanded benefits grid, where it says all of the different expanded benefits and then which plans offer which in Florida. So it's a really cool quick guide to use for people if they need to know what is offered by their plan. It is important to have a Florida Medicaid portal account because in this portal, you get you can check your enrollment status, you can enroll in a plan, or you can change your plans. You can get Medicaid letters electronically instead of mail, and sign up to receive email and text alerts. I think it's important to encourage this because sometimes we'll see issues with someone has housing instability where they may have been evicted or they are in transition. So if they are able to access the information about their health plan online, it's important to encourage the use of the portal. You can also go to each health plan's website. They have a lot of information there, including the member handbooks that can be downloaded. If the applicant is enrolled in a plan, encourage them to sign up for the plan's online portal too, because in the plans, in those portals, they can change their PCPs, their primary doctors. They can request new IDs. They can send messages and update their address and contact information if they need to. So next, working together to help children overcome barriers to healthcare. So Florida residents may experience barriers to healthcare access. So first, we'll have the complex application and enrollment processes. The application with DCF may get a little complicated. Not everybody would know how to navigate it. Sometimes people don't understand what they have to provide in order to satisfy what DCF is requesting of them. Many people are sometimes denied for small technical issues that they just don't understand exactly what DCF want them to upload or want them to provide in order for their application to be approved. So this is great for advocates to help with, to help them understand the notices, to help them understand what's being asked for in the portal. So this is where advocates can definitely step in. The enrollment process into the plan can also get complicated. It's sometimes hard to understand how to enroll, how do you change plans, and what's a good cause to disenroll after the 120 days. So that is one of the main issues that I see in this area. So another barrier is the multiple agencies. There's so many agencies involved in this that it can get confusing. Especially having all these portals. I think we've already talked about 3 different portals, and you can do different things in each of the portals. It's hard for people to figure out who to call if they have a problem and they don't know who to call to have it resolved. For example, some people may say, oh, my application was denied, I'm going to call ACA, and they don't understand ACA doesn't deal with applications. You have to contact DCF. Or I'm going to call DCF because I have Medicaid and they denied me a service. You have to do that with ACA. So the multiple agencies is confusing for people. They don't know who to call. Now, the complex eligibility requirements. Yes, this can get a little complex because a lot of people don't understand very well the eligibility and can create barriers to healthcare. So one example is the income guidelines. This is a very common one. These are different depending on the age group. And for example, if you're an adult and you are wanting to apply for Medicaid, the income threshold is extremely low for that. But for the child, is way higher. So a lot of people may say, well, I don't qualify for Medicaid, so I'm just not going to apply for anybody. It's like, well, just apply for the family, because even with the income, some people, the different children may qualify depending on the income, even if the adult doesn't. Now, the immigration statuses can also get very complicated because a lot of people don't understand the different immigration statuses. This is even hard for attorneys. If you don't practice immigration law, immigration statuses can get very complex. And the lawfully residing children statuses are also very complicated. A lot of people don't understand the different categories and also what you need. What kind of notice do you need to give DCF to prove? Do you provide the application for immigration status? Do you provide a notice? And all of these things can create barriers because people don't understand what is it that makes them eligible or not. All right, the next one will be health plan options. They can get complicated. It may be overwhelming. They may require the recipient to read tons of information online. And that's one good thing about this, is that there's so many websites out there with information about health plans that sometimes is so much information people don't even know where to start reading. So that could be a good thing, but a bad thing, because people don't know where to go to get clear information. So, but there are many organizations that assist individuals in understanding their Medicaid benefits. You know, you have the ACA's Medicaid helpline, and is 1-877-254-1055. And there's also a number for the choice counselors that help you understand your plan benefits. You can give this number to your applicants. Is 1-877-711-3662. Don't worry, you will have these in your materials. I already put them in the document called Important Links. You're going to have the numbers there to provide to your clients if they need to. Now, the next is, again, lack of clear information and education on all these issues that we are presenting can also become a barrier. Although there's a lot of information online, it's very overwhelming to navigate, like I said before. And connecting recipients to appropriate resources definitely helps with this. One thing that I've noticed with clients is the confusion that happens when you get transitioned between plans. Like I explained before, you may be in a Florida Kid Care plan, and then you get moved because your child turned 5. And it happens also when there's income changes, where you were on Medicaid, now you're earning too much money for Medicaid, now you get kicked over to the Kid Care portal, and vice versa. You have a decrease in income, and now you get moved from Kid Care to Medicaid. So these transitions may be confusing for people, and there are issues with this transition. So it's very important to explain to them how it works. Sometimes they don't understand it. Why is it that they got moved from one plan to another? So digital literacy, I think this is something that every legal aid attorney knows, that this is a barrier to almost everything in life nowadays, and definitely a barrier to legal issues. If a person is not technologically literate, then they're not going to take advantage of how everything is now online. So, for example, we have all the 3 portals that we discussed. So if the person doesn't use internet, they don't have emails, they're not going to go through the portals. So they're going to have to go through the old school methods of calling or visiting offices. And as we know, that takes a long time. Hold times are extremely high because a lot of people are calling, and you have DCF offices that are, a lot of people are going to the DCF offices, so you have to wait a long time. And another thing that I see all the time, that maybe a lot of people may think that everybody has an email address, but there's a lot of people don't even use email. So if you have an issue, somebody goes and, an advocate goes and signs the client for a portal, but then they lose their password information, and I don't even know how to use my email. Or how are you going to retrieve it if you don't have an email address? So digital literacy is definitely a barrier. So connecting clients with, how resources and how to improve the digital literacy, or just assisting them with all the online and technological issues, definitely can assist. Now, language barriers. Language barriers can be an issue, and I'm going to talk about language barriers 2 ways. You have the legal language barrier and technical barrier. A lot of people get lost in the legal lingo and the technical language that is used in healthcare, but also with different languages. So, of course, the websites are always available to be translated, and you have but you have a lot of the times different languages that are very hard, like dialects of specific countries that are not common. And then now I'm just going to mention it briefly, and I included that information in the materials, with the new implementation with Executive Order 14224, designated English as the official language. And there's an accompanying Attorney General implementation memo, and I have included that in the materials as well, that limited English proficiency programs it may take a hit. And as of today, the website, that was the www.lep.gov, has been suspended. And that was the website that used to provide data and best practices on serving people with limited English proficiency. So keep an eye on developments on that. All right, so there are advocacy tools to help someone with an issue in accessing the services and treatment needed. If a recipient has issues with a provider or is unhappy with the plan, they can file the health plan grievance or complaint. This could be a customer service issue. They don't like how they're being treated, or they're not getting quality services. They're having issues with providers or accessing providers. You start with a grievance or a complaint. The member handbooks have all the instructions on how do you do the grievance and complaint. So have them check their member handbooks. But if the recipient is denied a service, the plans reduces or terminates a service, medications or treatment, they're going to receive an adverse benefit determination. You can file, if you choose to do so, internal appeal with the plan within 60 days of that adverse benefit determination. The member handbooks, again, have all the information on how to do the internal appeal. If you're not happy with the appeal, the internal plan appeal, then you can escalate that to ACA. So you can request a Medicaid fair hearing, and you have to exhaust the plan's process first. Make sure that people don't jump straight to ACA, that they exhaust their internal appeal process. And you can file with ACA a Medicaid fair hearing request, and you can do that by calling. You can email them. That's the best way because you have proof that you have filed the fair hearing. By fax, or you can do it by mail as well. All right, so again, as I explained before, I'm going to go very briefly with the online portals because we've discussed it. I've included in this material the different websites. You have your DCF website, that's where you apply for Medicaid and the other public benefits. You have the Florida Kid Care website that's where you apply for the CHIP and subsidized health programs. But again, if you apply and you make a mistake and you apply for one or the other, that's fine because they should transfer you to the appropriate one. Then you have your Medicaid, the Florida Medicaid member portal, which is the portal where you can check your Medicaid eligibility, your enrollment status. You can update your address. You can send messages securely. You can enroll in a plan, change plans. You can file a complaint. You can check statuses of a file complaint. You can even go paperless and choose to receive everything electronically. And you can receive email or text message alerts. And as I said before, depending on the plan that you have, whether it's Sunshine, United, Humana, whatever it is, you will have a portal in your plan as well. All right, so other solutions and advocacy tools may also be helpful. Engage in community education where families and with children frequent, like schools. Back to school events are great. Any type of fairs where there's going to be a lot of children is great to do community outreach there to explain people how this works. And you can participate in health fairs. Those are great because you have a lot of community partners and organizations that will attend, and you can make great contacts, and you would know where to refer people to if they need specific services. So it's good to collaborate with those community partners to better serve your clients, and connecting clients with those available resources is crucial. Always, United Way is a great resource for clients to call and see what services are available in their community. You can also advocate on behalf of your clients with DCF, ACA, and their health plan. You will have to have your clients signed authorization forms in order to do this. And I've included those forms in the materials as well. You will have your authorized rep forms, and you will need some for ACA and some for DCF. So I've included those in the materials for everyone's use. All right, so now I'm going to pass it over to Robin for the wrap up of this webinar and take any questions that we may have.
Wow, thank you both, Glorian and Amy, for all this tremendous information. Guys, feel free to type things into the chat for your additional questions. I just want to make a couple of comments and then turn it back to do the Q&A. So the number one thing is don't take no. If your kid needs something, start with the provider. Get the provider to put in writing that the treatment or the service is needed to correct or ameliorate the problem. It's very easy. People will tell you, no, Medicaid doesn't cover this, Medicaid doesn't cover that. It doesn't meet the medical necessity standard. Put them to the proof with the federal EPSDT standard. Back it up with, get your provider to say that it's necessary, and don't drop it. I see we looked at the registration list before going in. A lot of you work at legal aid providers. If you're not already a Medicaid expert, you have them on staff, your colleagues that do public benefits. If you're outside the legal aid system, there are a lot of people that can help, that can assist you in using these tools and resources to get what your clients need, what the kids need. And so I really encourage you not to drop it. We didn't get into time and distance, but just because your kid lives far away from a provider, don't settle for no, right? If the child needs it, help find a way to get it. And folks are available to assist you in pursuing all the various remedies, from making a complaint through the portal, doing a grievance, working through the system. I just really, really urge you to advocate as hard as you can for the kiddos. So it's like in law school, we talked about issue spotting. I know this will help you with your issue spotting. There's no way we could make you the expert that these attorneys are in an hour and a half, but now you know what to look for. So I'm going to turn it back for answering the questions that appeared in the Q&A, and just want to say thank you again for your hard work and delivering on this information to folks.
Thank you, Robin. I did drop the link for the materials into the chat. I know sometimes the chat can move fast, so don't worry. I'll make sure to send it out in the email. This is going to be posted on YouTube. And before I even get to the questions, I'm going to do a few quick plugs. I'm going to start with the CLE code, because I know everybody wants this. So the CLE code, I dropped it into the chat, but it's 2508087N. This is also going to go out in the email, and it's also going to be in the YouTube description. Earlier on, Robin mentioned the training series, so we actually have 7 of those. So I think if I send it out via Zoom or via email, it's going to be too long. So to make it a little bit easier, I've compiled those into a Google Doc for now to make it easier. I dropped the link there, and this link will also be included in the email. That way, the email is a little bit shorter. So I'm also going to encourage people to this is going to be a favor and an assignment for everybody in the audience. I'm going to drop some links for FLS and for Florida Children's First, both websites and LinkedIn accounts and social media accounts. Make sure you subscribe to newsletters, bookmark these websites, follow these social media accounts, because there's always announcements, updates, outreach events, and a lot of opportunities for everybody to join and learn. So with that said, I did see a few questions already come in through the Q&A. One of them was already answered, but for the benefit of the audience, I'm going to make sure to read it out loud. The question was, what does full pay option mean? And this question was asked during Glorian's portion of the presentation when Glorian was discussing all the Medicaid benefits. It was the Medicaid, Medikids. And Amy typed in an answer, which is for families whose income is too high to qualify for free and subsidized coverage, Medicaid and CHIP coverage through Kid Care. The full pay option allows them to still access Florida Kid Care benefits by paying the full monthly premium. And she had added the link for the Florida Kid Care website with information with all the costs. So that was the question that was asked. Gloriana, if you want to add to that answer.
No, I think you said it all. Yeah, that's pretty much it. It's just when they are above the income threshold. But I can take the next one. I saw one with regards to asylum.
Yes, that's actually the next question. I'm going to read it out loud for the benefit of the audience in case they're not able to see the chat. Are children who are included in their parents' asylum application and have their work authorization and SSC eligible for Medicaid?
Okay, so I'm not an immigration attorney, but I definitely have learned a lot about immigration doing Medicaid, because all the issues that come up with immigration. So it is my understanding that once you apply for asylum, you cannot apply for a work permit until 180 days. Well, actually 150. You can apply 30 days before. So at 150, the adult can apply for work permits, and sometimes that includes everybody in the family applying for work permits. But for children, you don't need the work authorization. You only need to have that application for asylum pending for at least 180 days. So if they have that pending and they have that proof that, you know, this is the date that it was received and the application for asylum was made, you can submit that to DCF to prove your lawful residence, lawfully residing child status.
Right. We have another follow-up question, which I believe is tied to the previous one, which is, however, how is it that they need to pay over $200 per month, such a high amount?
Hi, and I can go ahead and try to take that. Unfortunately, and that actually refers to the full pay cost question that we talked about for kid care, and I know that is high. Unfortunately, though, that those families that qualify for that coverage aren't eligible for the subsidies, meaning that they don't get that state and federally funded share paid, so they're actually paying the full amount. And about that $200 price range is what Kid Care has established is needed to cover those costs to provide those services. So it's almost similar to what a private insurance coverage might be if you were paying premiums for them. So.
There are several great questions in the chat. People can't follow directions, and my friends, I see you all. So the first one about who to make complaints if transportation is falling through with a provider. Any suggestion? Is that a grievance directly with the provider? I'm starting Melissa Fellman's question. Then there's one on ICE. There's a bunch of good questions. Amy, you're on mute, so I don't know if you're answering. Amy, you're still on mute, so there you go.
Sorry, that was taking a moment to get off, and apologize. When you asked that, Robin, I was kind of fixated on the ICE question, so I'm quickly reading
whichever one you want to answer first.
So that one though, and Glorian, chime in as well. I mean, this is Sunshine's not showing up. I mean, there's lots of options. Transportation's an issue and a service. And I think Glorian touched on this a lot too, but working with the plans, again, to take those first steps, the Sunshine Medicaid plan, that's your home, your provider, you need to be working with them. So first contacting them, complain that way. But if the issue is not resolved, there's a complaint process. And even Gloria pointed out the complaints through ACA, through the statewide Medicaid managed care component, there's a whole complaint process there, because definitely that's not something that a client should be left doing at a doctor's office. Now, again, but in response to the question that Gloria touched on with eligibility with immigrant children right now, I think it's all very complicated. I think anybody kind of reading the papers, knowing what's going on, that immigration issues are kind of delicate and deal with a lot of things right now. So whether or not ICE has access to Medicaid contact information in Florida, the history is we've always protected information when people applied for Medicaid. We would always encourage families, particularly immigrant families, that they who maybe had mixed status family situations where some of them might have documentation, other members of the family didn't. Policy was in place and the laws were in place that protected that information. So we would feel confident in saying that the agencies wouldn't be sharing that information. And when they share that information and applied for coverage, the information they shared would only be used to determine the eligibility of the applicant. So to say if they don't have access, there's lots of things are changing where everybody, I think, is trying to figure it out. So I think that's definitely something that families need to consider when they're applying right now, because we just aren't able to say what we used to say, that your concerns about information being shared are protected. So
I want to answer the ICE question. So the for the ICE, does ICE have access to Medicaid contact info in Florida?
And thank you, Glorian, because that was the one I was just trying to answer. So hopefully you can add even more, but it is delicate. So please.
It's delicate. So we have heard through the news, of course, I think everybody has heard that there was an instance of the administration directing Medicaid information being released to ICE. To my knowledge, that hasn't happened in the state of Florida yet. But again, it's kind of hard to give any type of assurances to anybody. So I myself try to stay away from giving any type of assurance to any clients where are in mixed households, where there's people that may be eligible, but there's some undocumented or irregular status immigrants in the household. I try to assure them the best as possible that the current law states that they cannot share information, but we don't know what's going to happen tomorrow. So it's hard to answer that because we are not sure. And I believe there was another question. Amy, I think this is something that we probably can answer together with regards to the information on Medicaid for pregnant women and Medicaid for safe haven babies. So with Medicaid with oh, you're on mute. You want to take this one?
Oh, no, sorry. Go ahead, please.
Yes, with the Medicaid for pregnant women, I think a lot of people mean for the presumptive eligibility. The presumptive eligibility is when you apply for Medicaid and you indicate that you're pregnant, you are like presumptively eligible for Medicaid. So you start receiving services based on your declaration that you are pregnant. And we can include in the materials, in the interest of time, for the Medicaid for the safe haven babies information. And the next question was, in the event that a denial escalates to a fair hearing, I understand that the case is heard by ACA hearing officer. That doesn't seem very neutral participant. Noted. Is there a mechanism to appeal beyond this step? Definitely, you will have to go to the DCA, to the District Court of Appeal, to appeal an ACA decision. I believe I think I hit them all, Jorge.
Yes, you did. So I'm gonna drop the materials link again and the CLE information again. I know a lot of you are going to need your certificate of attendance, so start emailing me right now. What I'll do, I'll let some of those pile up and I'll start hammering them out. If for whatever reason you don't get the email from me, it might have been because I mistakenly forgot or skipped your email. So if you don't get it within 24 hours, feel free to bother me again as much as you'd like, and I'll make sure to get that certificate to you. So, by the way, I saw a lot of acronyms. I need to do a quick plug for a recent acronym webinar that we had, and Glorian was kind of the champion there. Like, we had a lot of public benefits acronyms, so I need to come up with some sort of award, but maybe I need to recruit Glorian to be one of our team captains for one of our next acronym webinars. So I mentioned earlier that I was going to share some information about social media and the accounts. I'll include that in the email. So make sure to follow all these accounts. Sometimes we post trainings on YouTube. There may be trainings that you missed out on. There's a lot of outreach events and a lot of great information out there. So make sure to access all of that. I don't see any other pending questions. So I want to thank all of our speakers, Glorian, Amy, and Robin. Amazing job as always. This was a great webinar, and thank you for teaching us about Medicaid. So with all of that said,
Thank you, everybody.
yeah, thank you all. See you at the next one. Have a great day.
Bye-bye.